Here's some questions you'll want to ask yourself as you think about developing or revising your campus's protocols. In the interest of time, we'll really just focus on the first 4 bullets that I have here. So before you embark on developing your protocols, you'll want to do a little bit of research. So first you want to find out what already exists on your campus. If you have a counseling center on campus, it's likely that they have protocols for dealing with students in crisis. But other departments such as Res Life, Campus Security, Student Affairs, all of them may have protocols or guidelines that they follow as well. Some departments may also have unwritten guidelines that they may use during an emergency. So it's really helpful to do an inventory of what already exists. When you look at what already exists on your campus, you want to keep track of any areas where various protocols differ or contradict each other, and note when they were last revised and who was responsible for creating them. Consistency throughout policies and protocols is really essential. Also, to help with the planning, you want to find out if there's any sort of university template for creating protocols and guidelines, and what type of approval process you might have to go through to have your protocols adopted by your university. Okay, so we want to hear from you now. So who do you think should be included in the process of developing and revising your crisis protocols? And if you can, you just type your thoughts into the left-hand side in the chat box there on your. Wait a minute for folks to type. Yeah, I think university police, so security and university police are really important. Student affairs, local mental health providers, so maybe not just on campus, but off campus as well. Or student affairs, dean of students, Res Life, counseling, very important. Barbara also made an important point here with legal affairs, housing, university relations. Eric also wonders if maybe parents should be involved. That's an interesting question. Great, so just another second to make sure everyone's typed in their thoughts. Health services, you guys have covered a lot of the important players here. Faculty, great. Okay, thanks so much for your thoughts. I think you guys covered a lot of the important players. Once you've identified your relevant stakeholders, it's important to clearly define their roles and responsibilities. So within this, you want to decide who will be included in the development or review process for your protocols, and also who has a role in the implementation and use of these protocols. Some campuses may choose to bring together a large group of stakeholders to develop their protocols to make sure that all the necessary areas get covered, while others prefer to include a smaller group of people in the development process, but then ask a broader group to review the protocols and provide feedback. Either way, you'll want to consider how you'll take steps to get feedback from folks on campus to make sure your protocols adequately outline the roles and responsibilities of your key community members. You also want to make sure, as someone mentioned, if you don't involve them in the actual development process, you want to at least include your university's legal counsel in the review process. So next is thinking about who your audience is for your. Some schools make one document for the whole campus community, so including students, while others prefer to make separate documents for, say, faculty or staff, or just for students or campus administrators. So who your intended audience is will also determine some of the language that you'll use and specific ways you'll want to tailor the information. If you don't include students in your audience for your protocols, then you'll want to consider how your campus will convey this information to students. It's important that your protocols be transparent, with students and their parents or guardians understanding the steps your school takes when a student is in crisis. So now we want to hear from you guys again with the million-dollar question, what should you include in your crisis protocols? So if you could just type again in the chat some things that you think are important to include in crisis protocols. Another few minutes while people type their thoughts. I have a few things here already. People are talking the importance of reporting and confidentiality, point of entry for the client. Follow-up is another important piece. Emergency contact numbers, those are also important. Here about communication and the flow of what would happen if a student is in crisis. Other thoughts? Counseling for students and for student friends of a student. So yeah, that's an important piece as well, not just the person who's in crisis, but those who may be also affected by the crisis. Great. You guys have some great thoughts about this. So the JED Foundation protocol framework is divided into 3 main topic areas that you'll want to think about addressing either in your crisis protocols or other campus policies or guidelines. Because we're really short on time, I'll only be touching on a few areas within these broader topic areas. So this is by no means a complete list of what you'll want to consider when developing your protocols. So within developing a safety protocol section, the framework prompts you to consider who would prepare staff or other campus community members to identify a student at risk. So would you provide a list of warning signs or some other sort of education? And the steps that they should take once they have identified a student they're concerned about. Establishing clear guidelines on the roles of different community members. So for instance, how does a faculty member or student's role differ from a campus administrator or counseling staff member? And who's responsible for responding to these concerns? That's a really crucial piece. Also, what decision-making process would take place once a student of concern has been identified? This section also prompts readers to thinking about the types of assessments you might want to use and who should be responsible for these. Also, how will you determine if a student who needs help, what should happen if they refuse it? Creators of the framework also recommend that all colleges and universities have written emergency contact notification protocol that clearly define when notifications can take place and the details, the university's role, and expectations of these notifications. So it's important to outline the process of deciding whether or not to notify an emergency contact, especially when a student may not want the notification to take place. It's really important to note that colleges should avoid making blanket mandates regarding notification and instead make these decisions on a case-by-case basis with the understanding that not all students have a healthy relationship with their parents or designated contacts. All of this information should be communicated directly with students and their emergency contacts. The framework also recommends that this information be published in, say, a student handbook or on the appropriate university web pages so that it's easily accessible and can really be transferred. The framework also recommends having formal leave and reentry protocols, and I know we had some questions about that. Hopefully, those protocols can be in place to help normalize taking leaves of absence when necessary and to make the process seem less daunting. So as this kind of implies, the information should be readily accessible to students so that they understand the process. It's important to take into account the positive and negative accounts of what would happen if a student took a leave of absence for mental health reasons. So for instance, what would happen if a student left in the middle of the semester? You might want to explore what would happen to the student's health insurance coverage through the university if they take a leave of absence or cut back to part-time. Also, you want to work through the reentry process, which Julia will touch on a little bit in her legal considerations in a few minutes. Also, I wanted to mention post-vention here for just a minute. Some schools also decide that they want to add guidelines for what should happen in the event of a student death on campus. Post-vention isn't really covered, unfortunately, in the JED Foundation framework, but it can be helpful to have protocols in place for what happens in the event of a student suicide on campus, and maybe listing what types of interventions or activities take place in the aftermath of a suicide. And this is, again, something that your prevention specialist can talk with you about if you have any questions about kind of how to add that into protocols. So there's a lot to think about when developing protocols. So some main points in terms of maximizing the success are making sure that the roles and responsibilities of your key stakeholders on campus are clearly outlined in your protocols and the procedures are clear and consistent throughout. I really can't overstate the importance of the consistency. In an emergency, you want people to know exactly what to do to help a student in crisis. Also, be sure to define any terminology you use so that your protocols are clear and easy to understand. And lastly, it's helpful to designate a point person who is responsible for answering any questions that come up about the protocols. This person may want to be responsible also for making sure that protocols are up to date and make any revisions that need to be made periodically. So that was my quick and dirty description of what should be included in crisis protocols and some considerations.